Clark, you were in HR up at the university for many years, head of HR, I think, in the end, before you retired. And of course, in that position, you had cause to deal with insurance issues for your employees. Now, when you came to retire, you chose to come down to Bob here at LSS Insurance. Can you tell us why?
Well, you know, as we retired people at the university over the years, Medicare and the supplements are quite complicated. Okay. And then they introduced what's called a Medicare Advantage plan, which is a broader plan, but it covers everything Medicare and the supplements used to cover. Okay. And it gets kind of complicated. Yeah. So as people retired and needed direction, this agency was one of the ones that we sent people to.
So you were steering people down here anyway, and then chose them yourself.
Right, because we knew that they knew what they were doing here. So, and we didn't develop that expertise at the university because we didn't sell the plans. People were on their own after a while. So.
It can be a kind of a scary thing, and of course, as you said, some of these plans are so complicated. How in the world would anybody sit down and figure it out by themselves?
It is. It's very complicated, and when I retired early, so I stayed on the university's plan for another 3 years after I retired, and then when it came time to go on Medicare, then I had to choose. Yeah. Which plan I wanted, and again, even for me with the experience I'd had, it was still confusing. Right. Yeah. And so I came in and met with Bob, and one of the things Bob does, which is really nice, is he has a computer model where he inputs all of your prescription usage and your behavior with your medical practitioners, the doctors and so forth. And then he'll plug them into a model that compares the top plans that are available and the costs associated. Okay. And then after a little discussion, we're able to decide which plan works best for me. Okay. So for example, when I went on a plan and it was time for my wife to go on a plan, our needs were different. So she went with a different company than I did. Okay. And Bob engineered that when, you know, normally I don't know that we would have done that. Mm-hmm. But because he's very thorough and very good at helping the individual decide what needs to happen, then we can make those decisions with some degree of intelligence, right. I guess. Yeah.
So I think it's clear that when people are coming in, they're not just all getting shoved into one box. Bob, being the expert he is now, is taking the time to sit down with everybody who comes in and find out their each individual needs.
That's right. And every year, towards the end of the year, when it's time to select a plan, the way it works is you have to select a plan every year. Okay. You just don't automatically stay on. Okay. And so Bob sets up a meeting with each and every client that he has, and we come in and he goes through the whole process of comparing again. And it's usually a half-hour to an hour meeting, so he's really putting in a lot of time and effort to get people on the right plans. Okay.
Yeah, because he cares. I mean, it's not just a job, is it? It's something that he really cares about, that everybody's getting exactly what they need.
Well, he's very good at it. He knows the plans inside and out. Right. And of course, he has a great staff that works with him. At the time my wife went on, his daughter Wendy was working here. She's now out on maternity leave, I believe. But last year we had a hospitalization in our family that needed special attention. And the providers, there were a number of hospitals involved, and the providers were really having a hard time getting the billing right with the insurance company, and so they were trying to bill us probably double or triple what we really owed. And so Wendy had a meeting here at the office. She brought up the agents from the company, and we met and went over everything that had happened. They went back, negotiated with the providers, and it took a little while.
Right.
But in the end, we ended up only paying what we were supposed to pay. Actually, we ended up paying less.
Yeah. Well, that's always
and so
that's always a good thing.
and so yeah, with the help of this office, they were able to really help us out in terms of that negotiation.
Okay. Well, Clark, we thank you very much for coming in and sharing some of your experiences today. It seems that if you want some really good caring for you and your own needs, individual needs, come down here to Bob and LSS Insurance and see what they can do for everybody else, right? You couldn't be more happy, could you?
You bet. I'd highly recommend them.
Okay. Thanks so much, Clark.